Hello, my name is Alicia Aguilar. I represent and is a student of the United States University. This is my discussion for week 8, a PowerPoint presentation for my course with Professor Sandy McDermott, MSN 600 Evidence-Based Capstone Project. Today's date is April 22, 2021, and my topic is mobile-based education to promote medication adherence. The outline is for my presentation, my capstone project PowerPoint presentation. We will be discussing the background, my PCOT, study aims and hypothesis, methods and design, analysis, proposed intervention, expected outcomes, anticipated conclusions, implications to practice. Starting with the background. Non-adherence to chronic disease medications negatively affects the efficacy of therapy and elevates the risk of disease exacerbation and complications. Medication adherence remains an important issue in healthcare, and non-adherence has been depicted as a significant source of poor prognosis and outcomes among chronic disease patients. Adherence is a spectrum entailing a patient's understanding of the essence of taking medications prescribed to them by their care providers, remembering to take them on time, getting the prescriptions filled, and understanding all the directions specified on the prescriptions. Thoughts and beliefs of individuals affect their behavior and emotions in relation to how they conceptualize health risks, factors that support medication adherence, and of course, obstacles to effective therapy. This is the PCOT, the problem. The problem is medication non-adherence among chronic disease patients due to behavioral factors. A population, chronic disease patients. Intervention, mobile-based education and predictive tracking. The comparison, chronic disease patients under intervention and the general population. Expected outcomes, behavioral paradigm shift towards better medication adherence, and my given time frame, 6 months. The study and aims and hypothesis. Aims to use social cognitive theory in implementing evidence-based findings on the use of mobile-based education and predictive tracking intervention to foster improved medication adherence among chronic disease patients. My hypothesis on this? Mobile-based education does not promote behavioral change towards medication adherence among chronic disease patients. And then the mobile-based education promotes behavioral change towards medication adherence among chronic disease patients. My method and design. This project will utilize a mixed methods approach and will be conducted in 2 phases. The first phase will employ a descriptive cross-sectional study design for behavioral analysis of the target population. The second phase will follow a prospective cohort design to implement the intervention and measure the change in medication adherence over 6 months. The participants will be purposefully selected to include all the chronic disease patients at the practice in the first phase, but random selection will be done in the second phase to obtain the required sample. In both phases, inclusion criteria will be based on the willingness to participate. There will be no exclusion criteria employed in both phases. Quantitative and qualitative methods will be used for data collection and will include a survey in the first phase and live interviews and observational learning in the second phase. Analysis. Data analysis will employ a correlation test using Pearson's correlation coefficient to elucidate the relationship between the 2 variables. This test will help establish whether there is a positive or negative correlation between intervention implementation and improved medication adherence. A chi-square test will be then performed to confirm the relationship between the dependent and independent variables in this study. My proposed intervention. This project aims to implement an evidence-based, mobile-based, and predictive tracking intervention on a cohort of patients selected from the hospital's register of chronic disease patients. This intervention will be designed based on the data obtained from a primary study in the first phase, aiming to elucidate the common behavioral factors that contribute to non-adherence among chronic disease patients. This primary study's success will be the baseline factor that will influence the development and implementation of the intervention. The patient's willingness to participate will also be a significant factor, given that one of the inclusion criteria will be the willingness to participate. The use of the intervention will also be influenced by the patient's competency in using technology, given that this will be a digital intervention. Expected outcomes. This project aims to instill a behavioral change in the study participants to foster improved medication adherence. The main expected outcomes will be as follows. 1. Improved medication adherence to medications among the chronic disease patients at the practice. 2. A behavioral paradigm shift to better adaptive behaviors for medication adherence. And 3. A significant increase in the practice's adherence rate within the 6 months of intervention implementation. Anticipated conclusions? The anticipated conclusions will be as follows: that human behavior is a major contributing factor to medication non-adherence, that mobile-based education predictive tracking intervention is effective and efficient at fostering a behavioral paradigm shift among medication non-adherent chronic disease methods, that the above intervention can be effectively employed to promote medication adherence among chronic disease patients who are non-compliant at a large scale, provided proper implementation of such an intervention is well conducted. Potential implications to practice. This project will significantly impact the current rates of drug adherence among chronic disease patients at the practice, with an expected increase within the 6 months of intervention to implementation. It will put the practice at the limelight of medication adherence exceptional performance. Overall implication? Better chronic disease patient prognosis and eventual clinical outcomes. Reduced rate of developing complications, reduced morbidity and mortality rates, healthier population. Thank you for watching and listening to my Capstone Project PowerPoint.